Good afternoon. My name is Dr. Cosentino. I'm here today with Dr. Gelber, and we're in Las Vegas teaching the comprehensive hands-on Botox training program as well as the comprehensive dermal filler. And right now, Dr. Gelber is going to talk to you about how to prevent ptosis. Correct? That's what
Absolutely.
Okay, how to prevent ptosis. And it's a great pearl in aesthetics because it's something that happens so commonly, and I believe, and I'm sure she's going to explain it to you as well, it's something that's so easily preventable. If you just follow correct technique and you just, you know, do the right thing, it's not difficult, and but it is very important, and it is so common that we really want to make sure that everybody understands, you know, how to prevent this.
Wonderful.
So,
thank you, Dr. Cosentino. I sure will.
Okay, thanks.
Okay. So as Dr. Cosentino said, this is, when you're talking about Botox, the #1 complication. If you remember back to the statistics that we looked to, Allergan reports that 3.2% of all Botox treatments in this country result in a ptosis. And that is the national average. 3 to 4% of every single Botox treatment that's done will result in a ptosis. And I would ask you in your office to aspire to make that number 0. And I think that if you aspire to that, that there is no reason that you cannot come very close to making that 0 by just doing a few very simple things. Okay, so Dr. Cosentino had spoken a little bit about where you can inject, and I want to clarify that even more, and when you start, I want you to be meticulous about this. So, this is a picture of somebody with a ptosis. If you take a look at our Cutera rep, a plastic surgeon injected her. She's wearing her bangs really low because she has a ptosis. It's that common. Even people in the industry get burned. You don't need to. So anyway, have the patient look directly at you, straight on, pupils ahead. I want you, when you're first starting out, to take a look at the pupil. Okay, take a look at the pupil, and I'll show you on either side. But I want you to take a look at the patient's pupil. I want you to go directly up, and I want you to put a pen mark or a fingernail mark or anything directly over the very top of the brow, directly over the pupil. From here until the very tail where we're talking about the lateral eyebrow lift, you may not inject for a minimum of 1 finger breadth from that dot to the tail of your eyebrow, period. If somebody has a low or weak frontalis where their forehead's about this high, you may not be able to inject the lateral forehead at all. You just can't. Because if you try to get this one wrinkle with Botox, you will drop an eyebrow every time. So a lot of people always want to put, almost always the patient rubbed the eye. I think that's blaming the patient. I think 99% of the time that this is prevented by you inject meticulously and you put the Botox in the right place to start. The other thing is, if you draw a line here and you inject here, but you direct the angle of your needle like this, and your needle is a ½ inch long, where are you depositing your product? You might have your entry point here and be depositing it here. So you need to know not only where is the entry point of your needle, but where are you depositing the Botox, because that's what matters. And remember, you've got a centimeter of diffusion with your Botox. So fine to inject here, fine to inject here, not fine to inject here, and you will get a ptosis. So that's part 1. Where do you put the Botox? Part 2 is the patient part of this. And I don't care if a patient has been injected every 3 months for the last 12 years. Every single time a patient walks out of our office, we review our discharge instructions, because how they take care of their Botox is also very important. So patients for 4 hours after their injection cannot lay down. They can't go to yoga. They can't put their face in a massage donut or go to an acupuncture appointment or do any other fun horizontal activity for 4 hours. They're not allowed to touch their face, they're not allowed to rub their face, and I tell them to pretend they're a crazy dog with a lampshade around their neck and just leave their face alone for 4 hours. And then don't just tell them what not to do, tell them why. And I tell them because I put the Botox in a specific place. If you move it over here, what's going to happen is you're going to walk around for a couple weeks like this. And when patients know why you're telling them not to do it, they won't do it. So those will be my pearls. In 3 years and several thousand patients, I've had 1 ptosis. And the patient got called a ½ hour after a Botox appointment that she had cancellation. at her acupuncturist, and she went right there and she put her face in a donut. And she called me up and she said, I know exactly what I did. The one last thing is I would tell you, be able to handle a complication if it comes up. So if we go forward a slide or two, there's a thing about AAOPM. And I would recommend that you do have this in your office. 70% of the time, if you do have an eyelid ptosis, not necessarily a brow ptosis, but an eyelid ptosis, that if you have this, it will temporarily resolve the person's ptosis. An eyelid ptosis on average only lasts 2 to 3 weeks, so they're not going to be down for the whole 3 months most of the time. 70% of the time, if you put 2 drops of this in their eyelid will pop right back up. You'll be happy, they'll be happy, and then they can continue to do that 2 or 3 times a day for the next 2 weeks until it wears off. It means that you don't have somebody walking around town with a ptosis saying that you did their treatment. So, my goal for you would be that you never have that ptosis, but if you do have it, I want you to have the tool that will hopefully make it so that you don't have a problem or an unhappy patient for a few weeks. So, any questions? Okay, so when we're injecting this afternoon, anybody who gets a glabella or forehead injected, when I walk up and you're ready to start injecting the patients, I want to see a dot directly above the pupil on the eyebrows. And at first, I would do it on every single patient, but I want you always to mentally see that dot, even if it's 5 years from now. I don't care if you put it on, but I want you mentally to have that dot right there. Okay?